muscles, 5 vital organs. Did you know, guys? The body is a remarkable machine working together that allows for life, movement, cognitive function, growth, repair, reproduction, and many other functions. And I'll be looking at a few this afternoon. So what is human anatomy? This deals with the way the parts of humans interact to form a functional unit. And physiology deals with the mechanical, biochemical, and physical functions of humans. So these are a few of the systems: the nervous system, respiratory system, circulatory system, the digestive system, the skeletal system, integumentary system, reproductive system, the immune, endocrine, and excretory systems. Give me a minute, guys. Yes. So, firstly, I'll be looking at the skeletal system. The human body exhibits a variety of movements from walking, bending, and crawling to running, jumping, and climbing. The framework that enables us to do all these activities is the skeletal system. Humans have much as 300 bones at birth. However, the bones start to fuse with age. At adulthood, the total number of bones is reduced to 206. And this is just a diagram depicting some of the bones that are in the body. So the function of the skeletal system, it protects internal organs, releases fat, produces red blood cells, stores and releases minerals. It facilitates movements and supports the body. The skeleton also protects several vital organs, as mentioned earlier, such as the heart, the lungs, and the liver. And bones are attached to other bones through ligaments and fibrous connective tissues. Joints are points at which two bones meet and then enable a range of movements like rotation, abduction, adduction, protraction, retraction, and many more. Based on the flexibility and mobility, joints can be further classified into movable joints and immovable joints. So a few of the diseases that may affect the skeletal system: Paget's disease, and this is a chronic bone disorder that causes affected bones to become large and misshapen. And we all know this one, osteoporosis, and this results in a reduction of bone mineral density and can lead to an increased for fractures. Next, we'll be looking at the human circulatory system. So the circulatory system is a network of organs that allow the circulation of blood throughout the body, known as the cardiovascular system or the vascular system. The vital function of the circulatory system is to transport blood to all parts of the body, which is extremely important because it carries nutrients, oxygen, carbon dioxide, hormones, and blood cells, which are required for the nourishment and growth of cells in every organ. It is a closed network consisting of some components: the heart, blood, and the blood vessels. With the help of certain other organs, such as the lungs, they are responsible for the circulation of blood in the human body. Give me a minute, guys. My screen. All right, I had a technical difficulty a while ago, so let me just go back a little. Am I going? Not moving. My camera is muted. All right, sorry about that a while ago, guys. So we're looking at the circulatory system. We're looking at the heart. The heart is a muscular organ which is located roughly at the body's midline in the thoracic region and is responsible for pumping of blood in the body. The heart is divided into 4 chambers: the right atrium, the right ventricle, left atrium, and left ventricle. The atriums collect the blood in the heart and the ventricles pump it to different organs. What is going on? All right, sorry about that, guys. Next, we're looking at the blood. The blood is a fluid connective tissue which plays an essential role in the circulatory system. It carries oxygen and nutrients to all parts of the body. It also regulates the temperature and acidic balance of the body. You have 2 types of circulation: pulmonary circulation and systemic circulation. Pulmonary circulation: after the heart receives deoxygenated blood from different parts of the body, it pumps those to the lungs for expelling the carbon dioxide and other impurities and collects oxygen, after which the oxygenated blood is sent back to the heart for systemic circulation. Systemic circulation, it carries oxygenated blood from the heart to all parts of the body through a complex system of arteries and capillaries. It also carries deoxygenated blood from these organs back to the heart through veins. Next, we're looking at the blood vessels. And there are 3 main types of blood vessels in the human body: the arteries, veins, and the capillaries. Arteries, they carry blood away from the heart. The arteries in the systemic loop carry oxygenated blood to different parts of the body, while the ones in the pulmonary loop carry deoxygenated blood to the lungs. Veins, they carry deoxygenated blood from the body and oxygenated blood from the lungs into the heart. Last, the capillaries. So arteries are broken down into a minuscule network of capillaries, which are the smallest blood vessels, and they are present in the lungs and muscles. So some of the diseases that affect the circulatory system are aneurysm, high blood pressure, arteriosclerosis, and coronary artery disease. High blood pressure, also going by the term hypertension, this is a condition that is defined by the increased force required to pump blood through your arteries. It is often described as a disease without any presenting symptoms, but over time, this excessive force can damage the heart and lead to stroke, heart disease, or kidney problems. High blood pressure does not always have to begin at the heart, as seen with arteriosclerosis. So arteriosclerosis and coronary artery disease. Here, blood vessels, they narrow due to cholesterol and plaque buildup in the walls of your arteries, eventually restricting blood flow. This means greater force is required for the blood to pass through these narrow areas to be able to deliver adequate blood supply, causing increased blood pressure. If this blood vessel narrowing occurs in the vessels supplying the heart, it can trigger a heart attack. All right, so next we'll be looking at the nervous system. The nervous system is a complex collection of nerves and specialized cells known as neurons that transmit signals between different parts of the body, and it is essentially the body's electrical wiring. Structurally, the nervous system has 2 components: the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain, the spinal cords, and nerves. The peripheral nervous system consists of sensory neurons or ganglia and nerves that connect to one another and to the central nervous system. Functionally, the nervous system has two main subdivisions known as the somatic or voluntary component and the autonomic or involuntary component. The autonomic nervous system, it regulates certain body processes such as blood pressure, the rate of breathing that work without conscious effort. The somatic system consists of nerves that connect to the brain and spinal cord with muscles and sensory receptors in the skin. In the body, the neural system integrates the activities of organs based on the stimuli which the neurons detect and transmit. They transmit messages in the form of electrical impulses and convey messages to and from the sense organs. Thus, the nervous coordination involves the participation of sense organs, nerves, spinal cord, and the brain. So patients with nerve disorders experience functional difficulties, which results in conditions such as epilepsy, in which abnormal electrical discharges from brain cells causes seizures, Parkinson's disease, which is a progressive nerve disease that affects movement, multiple sclerosis, in which the protective lining of the nerves is attacked by the body's immune system, Huntington's disease, which is an inherited condition that causes the nerve cells in the brain to degenerate, and Alzheimer's disease, which covers a wide range of disorders that impacts mental function and particularly memory. Next, we'll be looking at the human digestive system. And we all know that digestion begins from the mouth. The digestive system breaks down food and assimilates nutrients into the body, which the body then uses for growth and cell repair. The major components of the digestive system are the mouth, the teeth, the tongue, the esophagus, the stomach, the liver, the pancreas, the GI tract, small and large intestines, and the rectum. The process of digestion begins with the chewing of food. Then the saliva mixes with food, forms a bolus, a small rounded mass that can be easily swallowed. Once swallowed, the food travels down the esophagus and into the stomach. The stomach then secretes strong acids and powerful enzymes that break the food down into a paste. It then moves into the small intestine where the food is broken down even more because of the bile secreted by the liver and powerful digestive enzymes from the pancreas. This is the stage at which nutrients are absorbed from the food. The leftover materials then move onto the large intestine where it is transformed from liquid to solid as water is removed. Finally, it gets pushed into the rectum, ready to be eliminated by the body. And these are some diseases of the digestive system: hepatitis, cirrhosis, gastric ulcer, gastritis, parasites, constipation, appendicitis, Crohn's disease, ulcerative colitis, pancreatitis, or diverticulosis, just to name a few. Next, we'll be looking at the reproductive system. The human reproductive system is also known as the genital system that comprises internal and external organs that help in reproduction. It varies for both males and females. Hormones, fluids, and pheromones are all connective accessories for the reproductive organs to function. The female reproductive system consists of the following: ovaries, which produces ovum, female eggs as the hormone estrogen, uterine tubes, oviducts of fallopian tubes are the other names given for uterus tubes. Also known as the womb, the uterus is a pear-shaped organ where the fetus grows. The cervix is the route to the vagina and gateway for sperm to enter, and the vagina acts as a route for a penis to enter during intercourse and the exit of the fetus during delivery. Next, we'll be looking at the male reproductive system. So the male reproductive system consists of testicles, which act as a storehouse for sperms. These oval-shaped organs are encased in a pouch that is called a scrotum. Next to the testes is the vas deferens, that are the accessory ducts for the male sexual system. When the sperm is formed, it is mixed with the fluids that are produced by the seminal glands, prostate glands, and Cowper's glands. The primary purpose of the Cowper's gland is to hide the semen volume and lubrication during intercourse. Next, we'll be looking at the respiratory system. The respiratory process involves the intake of oxygen and the exhale of carbon dioxide from the body. This system is also known as the ventilatory system, the gas exchange system, or the respiratory apparatus. So human beings possess lungs for respiration, and the process of respiration starts with a cycle of inhalation and exhalation. Inhalation results in the oxygen entering into the body, and exhalation results in carbon dioxide exiting from the body. Anatomically, the respiratory system comprises of the following organs: trachea, bronchi, the bronchioles, lungs, and the diaphragm. And some of the respiratory diseases include asthma, cystic fibrosis, lung cancer, COPD, just to name a few. The next system we'll be looking at is the endocrine system. And the endocrine system is responsible for regulating a range of bodily functions through the release of hormones. Hormones are secreted by the glands of the endocrine system, traveling through the bloodstream to various organs and tissues in the body. The hormones then tell these organs and tissues what to do or how to function. Some examples of bodily functions that are controlled by the endocrine system include metabolism, growth and development, sexual function and reproduction, heart rate, blood pressure, appetite, sleeping and waking cycles, body temperature. The glands of the endocrine system are where hormones are produced, stored, and released. Each gland produces one or more hormones, which go on to target specific organs and tissue in the body. So the glands of the endocrine system include the hypothalamus. The hypothalamus produces multiple hormones that control the pituitary gland. It's also involved in regulating many functions, including sleep-wake cycles, body temperature, and appetite. It can also regulate the function of other endocrine glands. The pituitary gland is located below the hypothalamus. The hormone it produces affects growth and reproduction. They can also control the function of other endocrine glands. The pineal gland is found in the middle of the brain, and it is important for your sleep-wake cycles. The thyroid is located in the front part of your neck and is important for metabolism. The parathyroid gland is also located in the front of your neck and is important for maintaining control of calcium levels in your bones and blood. The thymus, which is located in the upper torso, is active until puberty, and it produces hormones important for the development of a type white blood cell called a T cell. The adrenal gland can be found on top of each kidneys. This gland produces hormones important for regulating functions such as blood pressure, heart rate, and stress response. The pancreas is located in your abdomen behind your stomach. Its endocrine function involves controlling blood sugar levels. So some of the diseases of the endocrine we're looking at. So dozens of conditions can cause issues in the endocrine system. These conditions can lead to health problems all over the body. Some of the most common disorders are diabetes, This endocrine disorder affects the way your body uses the energy from the food you eat. Diabetes develops when the pancreas doesn't make enough of a hormone called insulin, or insulin doesn't work as it should. Thyroid disorders. Several conditions can affect the function of the thyroid gland. Hypothyroidism happens when the thyroid doesn't produce enough hormones, or hyperthyroidism occurs when it creates too many hormones. Low testosterone or hypogonadism. In men, it can cause erectile dysfunction. It can also cause memory and concentration problems, changes in muscle strength, and low sex drive. It happens when the testes do not produce enough of the sex hormone, testosterone. Polycystic ovary syndrome or PCOS. Hormonal imbalance causes women with PCOS to have irregular periods, abnormal hair growth, excess acne, or weight gain. It can also lead to diabetes, increased risk of metabolic syndrome, and infertility. Osteoporosis. When a woman's ovary doesn't produce enough estrogen, bones become brittle and weak. Although it is more common in women, men sometimes have osteoporosis when testosterone levels get too low. So people with an overactive parathyroid gland may also have weak bones. Next, we'll be looking at the immune system. The immune system is made up of special organs, cells, and chemicals that fight infection or microbes. The main parts of the immune system are white blood cells, antibodies, the complement system, the lymphatic system, the spleen, the thymus, and the bone marrow. These are the parts of your immune system that actively fight infection. The immune system keeps a record of every microbe it has ever defeated in types of white blood cells called B and T lymphocytes, and these are also known as the memory cells. It means it can recognize and destroy the microbe quickly if it enters the body again before it can multiply and make you feel sick. The main parts of the immune system are white blood cells, as I said earlier, antibodies, complementary system, lymphatic system, spleen, the bone marrow, and the thymus. So what are white blood cells? White blood cells are the key players in your immune system. They are made in your bone marrow and are part of the lymphatic system. White blood cells move through blood and tissue throughout your body, looking for foreign invaders or bacteria such as microbes such as bacteria, viruses, parasites, and fungi. When they find them, they launch an immune attack. Antibodies help the body to fight microbes or the toxins they produce. They do this by recognizing substances called antigens on the surface of the microbe or in the chemicals they produce, which mark the microbe or toxin as being foreign. The antibodies then mark these antigens for destructions, and there are many cells, proteins, and chemicals involved in this attack. The lymphatic system. And this system is a network of delicate tubes throughout the body. The main roles of the lymphatic system are to manage the fluid levels in the body. They react to bacteria, deal with cancer cells. They deal with cell products that otherwise would result in disease or disorders. They absorb some of the fats in our diet from the intestine. The lymphatic system is made up of lymph nodes, which trap microbes, lymph vessels, and these are tubes that carry lymph, which is a colorless fluid that bathes your body's tissues and contains infection-fighting white blood cells. And these white blood cells are called lymphocytes. The spleen is a blood filtering organ that removes microbes and destroys old or damaged red blood cells. It also makes disease-fighting components of the immune system, including antibodies and lymphocytes. The bone marrow is a spongy tissue which is found inside your bones. It produces the red blood cells our bodies need to carry oxygen, the white blood cells we use to fight infection, and the platelets we need to help our blood clot. Last, the thymus. And the thymus filters and monitors your blood content. It also produces white blood cells called T lymphocytes. So the body has other defenses against microbes. As well as the immune system, the body has several other ways to defend itself against microbes, including the skin, and is a waterproof barrier that secretes oil with bacteria killing properties. The lungs, mucus in the lungs traps foreign particles and small hairs called cilia wave the mucus upward so it can be coughed out. In the digestive tract, the mucous lining contains antibodies, and the acid in the stomach can kill most microbes. Other defenses, body fluids like the skin oil, the saliva and tears contain antibacterial enzyme that help reduce the risk of infection. And the constant flushing of the urinary tract and the bowel also helps. Some disorders of the immune system, allergic diseases, where the immune system makes an overly strong response to allergens. Allergic diseases are very common. They include allergies to foods, medication or sting insects, anaphylaxis, which is a life-threatening allergy, hay fever, sinus disease, asthma, dermatitis, and eczema. Autoimmune diseases, where the immune system mounts a response against normal components of the body. Autoimmune diseases range from common to rare. They include multiple sclerosis, autoimmune thyroid disease, type 1 diabetes, systemic lupus, rheumatoid arthritis, and systemic vasculitis. All right, so this is the ending of this part of the presentation. And as I said earlier, Psalms 139 verse 14 says, I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right. Do we have any questions before I move on to the practical aspect of the presentation? Okay, no. All right, so somebody, True Faith, had asked me to go over back to, you can go 3 slides back. Tell me which one exactly. True Faith?
All right. Yeah.
You want me to start over?
Yeah, you can. No, you can't. Yeah, start. Yeah, start from the beginning.
to see me, I would ask her to sit and wait a while because blood pressure is to be taken at rest to get a correct reading. I'll be using my automatic blood pressure machine. Can you see us?
Yes, we can.
Yes.
All right.
Can
So,
see you, nurse.
can you sit upright for me? So when you're doing the blood pressure, the arm's supposed to be at heart level. So it is supposed to be elevated. In the ideal situation, the person is supposed to be sitting like this. Right, but you need to rest on the chair. Look on this side. Then I'm going to assess the limb. So I'm looking at the arm. I'm looking for swelling, lacerations. Yeah, she's seeing me. Laceration. I'm going to be assessing my pulses. So this is the radial pulse, the brachial pulse found between the elbows. And I'm feeling for my pulse. And let me go, if for example, if the arm is swollen, I would assess the next arm because I want to get an accurate reading. So Miss Taylor's arm is perfect. I'm assessing my pulse. Then I'll be attaching my cuff. All right, so the cuffs have come in different sizes. They have bigger sizes, they have sizes for children. So you'd want to get a suitable cuff for your patient or your client. And the cuffs, well, the automatic cuff tells you where to put where to find the artery. I'm hoping that you guys can see me. So you put it above the artery. Are you guys able to? Yeah, they're seeing. Ensuring that it is not too tight or it is too loose, because it will affect your reading. You'll get a wrong reading. If I was using my manual blood pressure, I would find the pulse and then I would use my stethoscope to listen. Then I would inflate my cuff.
Thank you. Your blood pressure is systolic pressure 140 millimeter of mercury filler. Diastolic pressure 98 millimeter of mercury filler. Your pulse is 107 beats per minute. Measuring result is your blood pressure is high. Thank you. Wish you a good health.
Okay, I don't know if you heard that. So when you're doing the blood pressure reading, the client is supposed to be quiet. No excessive talking, because that will also affect, no excessive movements, because that will also affect the reading. All right, so we're gonna be talking about our normal blood pressure reading. So we know that there are many things that can affect our blood pressure, such as stress, if the patient is hypertensive. So according to the American Heart Institute, a normal blood pressure is anything less than 120, which is your systolic, and less than 80, which is diastolic. So anything elevated, so there are different categories of the blood pressure reading. Normal, elevated, stage 1 hypertension, stage 2 hypertension or hypertensive crisis. So normal blood pressure is a blood pressure with a systolic reading that is less than 120 and a diastolic that is less than 80. When it's elevated, and this can be due to stress, 120 is... Pardon?
Not seeing the video.
So I'm talking now. I did the demonstration with the blood pressure. So I'm saying that elevated, the normal blood pressure is a reading with a systolic that is less than 120 and a diastolic that is less than 80. That is normal. Elevated is a blood pressure with a systolic reading that is 120 to 129 and a diastolic that is less than 80. So the systolic reading is a top reading. If you have a automatic blood pressure machine, is the top reading, and the diastolic is the bottom number. So high blood pressure or hypertensive stage 1, the systolic, which is the top number, is 130 to 139. And the diastolic, which is the bottom number, is 80, should be within 80 to 89. High blood pressure, which is hypertensive stage 2, the systolic is 140 or higher, or a diastolic of 90 or higher. And a person is in hypertensive crisis when the systolic blood pressure reading is higher than 180 and or a diastolic that is higher than 120. All right. All right, so now I'll be doing a demonstration on the sugar or your glucose reading.
Just so you know that your camera is off. If you're not already aware, that is.
Yes. All right, so as I said earlier, I'll be doing a demonstration on the sugar. Just getting my stuff together. All right. Turn on. So before I do my pricking, I would assess the fingers again. Can everybody see me? You're seeing the client?
Yes.
Yes, yes.
So I'm looking at the fingers. Again, you assess the arm for swelling, redness, pain, laceration. When you're pricking the finger, all right. So you want to prick the side of the finger because there are less nerves there, so it wouldn't be as painful. I'm gonna be cleaning my finger first. Alcohol swab. So I clean in a circular motion. All right, allow it to air dry, or if you want to dry with a cotton. I'll use my gloves, but I know her status, so. All right, ready? So I get my lancet. Ready? And you would get your reading.
The nurse
just
doesn't
some
matter
notes.
which finger.
Well, you try not to stick the thumb, but because if you're diabetic, for example, you have to rotate the sides. So you would not want to be using one finger every time.
Okay, okay.
So based on the patient's comfort as well, because some patients would ask you to use that same finger. because when you're pricking for a continuous time, it gets hardened. The skin gets hard. So you'd have to apply more effort to prick the skin. So you'd have to rotate your sides. But as again I said, it depends on the patient's comfort. So if they request that, then you would have to go by that. But try not to stick the thumb because it's more sensitive. And you prick the side of the finger because there's left nerves ending there as opposed to the pad of the finger. All right, so the machine comes in different types. You have millimoles per decigram. This machine that I'm using is a millimole per decigram. And then there's millimoles per liter. So if you have a machine that reads in millimoles per decigram and you do the blood glucose test, the reading will be higher. So what you need to do now, you need to divide by 18 to get your millimoles per deciliter. So, where's the, all right. So I'm gonna be doing my calculation. So Kamisha's blood sugar reading in millimoles per deciliter was 131, and I divided by 18 and I got 7.2, and that is okay for her. All right, so now I'll be going over the normal, some of the normal, what is normal and what is abnormal. All right, so for a non-diabetic patient, anything that is under 7.8, 4.0, some literature says 4.8, so 4.8 to 7.8 millimoles per liter is normal. For a patient with type 2 diabetes, anything under 8.5 millimoles per deciliter is considered normal. Type 1 diabetes, 5 to 9 millimoles per deciliter, that is normal. And for children, anything under 5.9 millimoles. So children with type 1 diabetes, that is 5 to 9 millimoles per deciliter, that is normal. So you would do your sugar test. First thing you wake up in the morning, you get that reading. That would have been a fasting blood sugar test. And then you would do it 2 hours after you eat. And they call that a postprandial glucose reading. So first thing in the morning, which is a fasting glucose, and 2 hours after you have a meal to get the correct and the accurate reading. All right. Any questions? Were the 2 demonstrations clear? Clear as mud?
Very clear to me, very clear.
As it relates to the blood pressure, does it matter which hand?
If it matters which hand, not necessarily. As I said before, some persons, if the hand is deformed or if there's swelling there, you would have to, normally we'd use the left hand, but if that hand is, something is happening to that hand, we want to go to the next hand. So it is not really to say, yes, you have to use this particular hand. But you'd have to do your assessment first to ensure that that limb is not swollen or there's no deformity, obvious deformity, any laceration going on there, because you will get a false reading. Any other questions? Okay, no? All right, so this has brought me to the end of my presentations. Thank you so much for your time. I hope that it was clear and that we all learned something. Okay, back to you, Sister Venetia.
Thank you so much, nurse, for that very impactful presentation, especially the demonstrations at the end. I'm just asking